Hello, welcome to Prime Time with Next Level Prime. This is a monthly series meant to let our listeners hear about all things Next Level Prime. I'm your host, Dr. Karen Rakers, Chief Medical Officer at Next Level. I'm a family medicine physician and I've been with Next Level for 9 years, and I have been thrilled to be overseeing the Next Level Prime program since it launched about 2.5 years ago. So, just as a reminder for our new listeners, Prime is an advanced primary care model. We contract with employers, which allows their employees and dependents to have access to unlimited healthcare services at Next Level. We have a virtual care platform, and we combine that with a large network of in person locations across the Houston, San Antonio, Austin, and Beaumont areas. And care provided includes primary care, preventive care, chronic disease management, urgent care services, health coaching, counseling services. We also include nurse care navigators, which help our patients with their healthcare journey, as well as managing any referrals that might be needed. And we also include most common labs and routine vaccinations. And the best part is that all of this is provided to the patients at no cost, no copays, no deductibles, and no surprise bills from Next Level. Today, I am thrilled to have Mei Lene Ranada, certified physician assistant, and our lead clinician on the Prime team here on the program with me. So, welcome, Mei Lene.
Good morning, everyone. It's so nice to be here.
Awesome. Thank you so much. So, tell me, I guess, a little bit about your role as a Prime medical provider.
So, as a Prime medical provider, I function as many patients' primary care provider. Um, as a primary care provider, I look at it as my job to really help all my patients navigate their healthcare. We provide high quality care through a virtual visit platform that allows convenient access to many patients. As a Prime medical provider, it is unique that it is all virtually based, but I really view this role as being part of a healthcare solution. We're able to provide primary care services at extended hours, times, really whenever a patient needs it and wants to access it from a convenient location, wherever that patient might be.
That sounds absolutely terrific. You mentioned a lot of the care is virtual. That sounds a little bit different than maybe traditional primary care healthcare delivery. What would you say is more unique, I guess, about the Prime healthcare delivery model?
So the Prime healthcare delivery model is really a hybrid. I think in other outside resources, you really haven't seen this model used before. We have the advantage of having a lot of convenient next level clinics around the Austin, San Antonio, Houston markets. And so patients are able to go to those clinics to obtain a physical exam, vital signs, lab testing, and we can use that information then to help support our virtual visits whenever we see them virtually. So often it feels that when you do virtual medicine, a lot of the puzzle pieces are missing. But with Prime, we are actually really able to fulfill that clinical picture. We work together as a Prime provider team, as a virtual provider team, to provide cohesive, team-based approach to our healthcare, make sure that we're all on the same page, and that everyone is getting the same level of service, consistent care virtually. And then we also work very closely with our clinicians in the clinic to fulfill that clinical picture. We're able to talk to them during the day. They're able to call us if they need help. So we all work together kind of amongst teams, within teams, to create this product for our patients.
You mentioned, having all the locations available and coordinating care. I think definitely a difference. There are lots of organizations, promoting primary care as a completely virtual platform. But I think as medical providers, we can agree that you need the patient to be seen in person for certain things, and that might get lost in translation with some of the other models out there. But yes, definitely having the convenience of seeing the patient virtually, but saying, oh, you actually need a lab. Let me have you run into the clinic that's also right down the street from you is super convenient.
Yes.
So, I know in primary care, the annual physicals, preventive care is super important. Tell me what the process looks like to actually get your annual physical done with Next Level Prime.
So the Prime annual physical is actually a three-step process. The first step is a Prime virtual visit with a Prime medical provider. During that visit, we're going to obtain a thorough medical history. We'll review any preventive guidelines, including cancer screenings based on that patient's profile. It really is a check-in on that patient's overall health status. And kind of seeing, has there been a lapse in care? Have you gotten regular care? And what are you due for currently? And after that virtual visit, we'll schedule them as the second step to go to a Next Level clinic location that's convenient for them and complete their clinic visit. During that visit, they'll get their full set of vital signs done, including their blood pressure, a full physical exam, any testing that needs to be performed, including an EKG, any x-ray, lab draws that are needed, and then immunizations, vaccines, if warranted at that time too. The last and final step is a virtual visit follow-up with your Prime provider. It's often the same Prime provider who saw you initially. And at that time, we discuss all the clinical findings, all the vital signs step by step, what the clinical exam looked like, all your lab results. We often will share our screen so that the patient can see in real time what we're seeing, ask questions. We want it to be as interactive as possible. And then that really then completes the full three-step Prime physical process.
That sounds super comprehensive, first of all. And I mean, I guess maybe some people might say, well, it's three steps, why would I want my annual physical to be three steps? But I think what you're saying is the first step is done from the convenience of their couch or wherever they are at home. So really the in-person part where they have to go into the clinic, is really much faster than a typical in-person visit for an annual physical, because you're just completing the things that need to be done in person. And I actually think, historically, physicians and medical providers have played phone tag with their patients after a visit where they are trying to track them down to talk about lab results and results of other testing possibly. And so this one, it sounds like it's just scheduled so that it's easy for the patient. They know when they're going to talk. And again, it's, from their couch or, wherever they want to be. That's super convenient. So that sounds terrific. Tell me a little bit more about annual physicals. Why do we even care about that? Why are they important?
Annual physicals are really an integral part of health maintenance. It really focuses on primary prevention. Primary prevention is really trying to focus addressing any issue before it actually happens, before a patient is symptomatic. I often, with my patients, use the analogy that you don't put sunblock on skin cancer, right? We all use sunblock to prevent skin cancer. So instead of waiting to get cancer, right, we say keep using the sunblock and hopefully that'll prevent you from getting cancer in the future. Well, Prime, physicals are kind of the same, or physicals in general. We say that we want patients in good health. We want to make sure that you're healthy, even though you feel healthy, you may not be. A lot of chronic conditions like high blood pressure, prediabetes, often patients will have these even years before having any symptoms. And without that physical, without that touch base with the provider, they may be unaware. A physical is also a good time to really establish a good relationship with a provider, seeing if you really like someone's approach to medicine, the way they kind of treat their patients, develop that rapport. When you're sick, sometimes you can't be as selective. When you're healthy, you can really take the time to really talk to this person, invest in that person. A patient-provider relationship is a marriage, especially in primary care. Just like in sickness and in health, the same thing for primary care. We're here for you when you're sick, but especially also whenever you're healthy, to kind of help make sure that you maintain your health.
Yeah, and I think too, good point on the, pre-diabetes and hypertension, I mean, we know people walk around all the time with those conditions and have absolutely no idea just because they haven't had their blood pressure checked or they haven't had a blood draw to, identify those issues. And we know for sure that when those go untreated for, periods of time, that they do in fact lead to some really terrible things, down the road. So we want to make sure that we're identifying those things early and treating them to prevent heart attack and stroke and, kidney failure and dialysis, all those horrible things down the road. The other component, I think, I'm sure under the Prime program recommending like cancer screenings. So some of the screening tests we have for cancer are even actually preventative, like colonoscopy, or the other, types of tests like mammograms and pap smears, meant to, identify changes early that can be addressed before they become, a major problem. So definitely super important on that annual physicals. So back to, talking a little bit about hypertension and diabetes. What does that look like under Prime? How do you manage those chronic conditions under the Prime program?
So in the Prime model, chronic conditions are primarily managed by the Prime provider team virtually. Um, we do send patients to the clinic to obtain, valid clinical information, what their blood pressure is running, get blood work on them to see their kidney function, their cholesterol levels, and then we can use that information to really manage that patient virtually. We try to limit the amount of times patients have to come into the clinic to save patients time and really be more efficient in their care. After getting that baseline information, we can often do as many virtual visits as it takes to get that patient under better control. We don't have to worry about a patient paying for a copay each time or a patient even having to miss work based on our availability. We're open 7 days a week, even virtually, 9 a.m. to 9 p.m. So anytime a patient during the day needs to see us, they can for a virtual visit to talk about their diabetes, high blood pressure. Often we can even have a nurse, one of our care navigators who are licensed RNs, call to check in with our patients in between their medical visits and kind of check in on them, make sure they're doing well, that they don't need any refills. So with kind of the evolution of medicine, I think Prime has adapted and has really kind of used it to our benefit. We don't have to bring patients in the clinic as often as we previously thought. A lot of these things successfully are done from home virtually. I feel like there's a lot more compliance too. Patients are more willing to click a link, join, talk to their provider, than have to make all these arrangements in their schedule to come in to make a visit happen.
I wonder too if it helps, you're kind of engaging the patient a little more, maybe like someone with high blood pressure, having them do their home blood pressure so that you have information to make, those decisions. I think engaging them with what they're actually doing at home might help with just, getting those conditions under better control as well. What other resources do Prime members have under the program to help them with some of these chronic issues?
Prime has a lot of resources, which helps us really provide this holistic approach to healthcare. We know that health is a lot more than just numbers, medicines. It is lifestyle driven. So we have Prime Health Coaching available, which is also virtually based. We have Prime Emotional Wellness Counseling or Coaching, which is counseling therapy available to patients, also virtually based and included. I mentioned before our care navigators who are licensed RNs. These navigators have an immense amount of knowledge. They have a lot of patient bedside care experience. So they really are great patient advocates. They're there to help our patients with whatever they might need and really are an excellent resource for them.
Again, such a great comprehensive approach. For sure, we know that patients with chronic conditions, have struggles with, some emotional wellness issues, some maybe mental health issues. So having that counseling piece available is terrific. The health coaching component, so many people need that extra accountability to kind of, help them maintain those lifestyle changes, which we know are super hard to maintain on your own. So that is awesome. Have you seen any really great success stories with any of your patients that maybe, utilize you for primary care, maybe utilize some of our additional resources? What have you seen happening with your patients?
Definitely. I would say I've seen this whole program kind of work through fruition, how it's been designed to work. And it's really this amazing experience for both me as their provider, as their clinician, and for the patient. I had a patient who was pre-diabetic that was identified after their annual physical. We kind of talked about, hey, these are the lifestyle things you need to make to kind of help prevent you from progressing to diabetes. At the time, he was hesitant. He was like, oh, no, I got this. I'm going to do what I have to do. I'm sure it'll be better. 6 months later, he had progressed to diabetes. And at that point, he was like, man, I really have to take my health seriously. I think the word diabetes started to scare him. He engaged in Prime Health coaching. We had regular visits to kind of check in to see how you were doing. And within a few months, actually, he normalized his numbers and he no longer really had to worry about it. And he really said, without this program, I would have never known I was at risk for this. Without Prime Health coaching, I would have never known what to do. I thought I was doing what was right. I thought I was being healthier, eating better, and I clearly wasn't. My numbers were getting worse. And now I feel so much better. He even said, I didn't realize how bad I even felt before, that I was just normal. I thought I was normal, that's how everyone feels, a little bit tired, sluggish, just making it through. And now he feels like, I feel so good. I feel excited to wake up, go work out, and live my life. So I think that was pretty cool to see it all come together like that.
That story just warms my heart so much as a physician, a primary care physician. I am sure you feel maybe the same. What have you found to be rewarding as a Prime provider?
I'd say kind of career wise, I've worked in a primary care before this. I've worked in urgent care centers, kind of in different environments, and working with Prime outside of traditional insurance healthcare delivery is liberating. You don't have to worry about necessarily what you're putting in your chart, checking all the boxes. You get to just focus on your patient and what your patient needs. Additionally, with it being virtually based, there's a lot less distractions, I feel, for even patients. And at times, because they can just tune in from home, kind of go into their bedroom. They're not worried about everything else that they've kind of done or have going on. They can take that time for themselves. For me as a provider, I'm not thinking about all the other patients I have in patient waiting rooms or everyone outside the door. It's kind of just me and that patient in that visit for these dedicated minutes. We do offer a lot longer extended visit times to patients. We can have patients even come back just the next day for a follow-up session if needed. So it's really amazing to really kind of shift that whole experience, and delivery of healthcare, that it can be more than just minutes and dollar signs. It really is time and quality time. On a personal level, I would say anytime a patient thanks me at the end of the visit, that's really rewarding. I went to healthcare to be part of giving care to patients and helping people. And I feel like when patients say thank you so much, or this has really been a great experience, I find that rewarding. I find that that's a success. I'm fulfilling my dream as a healthcare provider.
Oh, that's so terrific. I love that. And sounds like such a great combination of, just the whole delivery model, being great for patients, but also being great on the healthcare team. I mean, I think that is huge. And we want all of our team members to feel like they're making a difference. And it sounds like that for sure is happening with you, which is terrific. So what do you think? I mean, we obviously this model is mostly done through employer contracts. And so why do you think from a healthcare delivery standpoint, from a medical provider standpoint, why do you think employers should actually care or be excited about this program?
I think the workforce in the U.S., employees could actually be considered an underserved population, right? Because of people working 9-to-5 jobs or having to work certain shifts, they often are unable to access healthcare. A lot of primary care offices models don't offer extended hours or weekend hours, and so these patients are kind of stuck in being obligated to work, having their jobs, and prioritizing that over their health. With Prime, they don't have to do that. They can access care whenever they need to. They are often able to do it from the convenience of home, even on lunch break at their work in the parking lot of their job. I've had patients do that. And I think employers can really shift the mindset or the culture to a culture of wellness, right? Instead of being focused on when patients or when employees are out for injury or out for illness, they can use Prime and really help promote wellness and make sure that their employees are healthy, able to prioritize their health without jeopardizing their jobs.
And what a great tool for employers to be able to say, hey, we're giving you free healthcare, unlimited free healthcare. Hopefully their workforce is healthier. Hopefully they're not having to miss work for, their appointments. Hopefully they're not having to miss work because they can't get their illness treated. But also, hey, we're giving you free healthcare. That's such an amazing thing. So I know, I would think that that would be a great tool for them to use as well on the employer side for retention and attracting great talent onto their teams. So thank you for sharing all this terrific information. I guess last question, what do you think is the most important things you really want your patients to remember after they, have a visit with Mei Lene Ranada, PA?
I always tell my patients, I really believe in educated patients, the best patient. I always tell them at the end of their visits, the more you do, the less you'll have to take. And it really is this relationship that, if you're proactive and you're wanting to take control of your health, the more that you're doing to help yourself to get better, and the more we do together, hopefully the less you have to take of your current medicines or the less medicine you'll have to take in the future. And it really is kind of this team effort. It is both of us working together to do what's best for you. And that's not always, I tell patients that's not always no medicine or not, not being able to stay off everything, but it's less of what you're taking, or it's finding that happy place where you're thriving. You're not just surviving, right? Living is one thing, health is essential to life, but we want you to thrive. We want you to have a great quality of life. And the more that you do, hopefully the less that gets taken away from any of that. So I think
Yes.
that's my advice.
Great advice. And I think, it kind of leads to like what patients' motivations are, right? And I feel like, we on the healthcare side think, okay, we want your hemoglobin A1C to be better, but really oftentimes the patient's goals have nothing to do with that number looks like. It's about how they feel. Are they able to spend quality time with their family? Are they going to be around to see their kids and grandkids, graduate high school or, get married or whatever it is. And so I think that is actually great advice, and, helping patients just like lead that really healthy and productive life that they want. So terrific. Well, thank you so much. I would, appreciate you coming on the show and chatting with us today. And hopefully our listeners found it helpful. Everybody have a great day.
Thanks so
See
much
you
for
next
having me.
time. Thank
Bye.
you. Bye.